The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. Our next guest has spent his entire career looking for a way to finish cancer, and he's not done yet. This fall, the Society for Immunotherapy of Cancer will honor him for his tireless efforts. Here to share more about that, we welcome from the Earl A. Child's Research Institute, which is part of Providence Cancer Institute, Dr. Bernie Fox. Great to see you again, Doctor.
Great to be back.
This is your passion. Immunotherapy is your passion. Explain to folks what it is.
So immunotherapy uses your body's own immune system to fight the cancer. So to go on and circulate through your body to detect where the cancer is and then destroy it. And so what's so exciting about this is it's been evolving over the last 40 years, and I've been very lucky to be into this.
Yeah.
And if you look at the first slide that I gave you, which has a patient on it that was treated now 40 years ago, and this patient, Linda Taylor, who was treated at the NCI with the gentleman who's Dr. Rosenberg, who's pictured with her, she was somebody who would have died of her cancer in 3 to 6 months. She got immunotherapy, a drug that only works by boosting the immune system, and all her cancer went away.
Wait, let's just take that for a second. That's incredible.
And this is a disease, melanoma,
doctor.
right? Which hits young women particularly, right? And at that time it was a death sentence. I mean, the survival rate of 2 years was less than 5%.
Right.
And so to have a drug that could actually cause patients to have their tumors go away, and then have 90% of the patients in the NCI study, 90% of the patients who achieved a complete response were out more than 20 years. So those patients had essentially been cured of their cancer. So that's why we use that word. Immunotherapy has the power to cure patients. It's not hyperbole. This is this is true. It can do that.
What are you most excited about when it comes to advancements over the last years?
What I'm excited about is one, we've had the Nobel Prize went for 2 checkpoint inhibitors, these drugs that take the brakes off the immune system, if you use a car analogy.
Right.
And those drugs have really revolutionized how many patients are treated with cancer. There are now 21 different cancer types that the FDA has approved these checkpoint inhibitors to treat. And so I'm very excited about that, and what people in this area should know is that that first trial that led to those checkpoint inhibitors was led by Dr. Walter Erba here in Portland, and so patients in the Pacific Northwest got access to drugs well before the FDA approved them, and so it's an exciting time. But now we've had 3 more of these, well, 3 more of those checkpoint inhibitors approved by the FDA, and these are again drugs that work by taking the brakes off the immune system. So that's great for the patients where that works, where their immune system is all revved up. But for the majority of patients, unfortunately, they don't respond to these checkpoint inhibitors. They need their immune system turned on. So what I'm most excited about is the cancer vaccine field, which is showing promise in pancreatic cancer, is showing promise in melanoma, and we're showing it here promise in head and neck cancer with studies led by Dr. Ram Leidner. So it's a very exciting time. When it comes to technology, how has technology helped you change, helped you advance in this research? And maybe how to share the research as well. Yeah, no. So it's both 2 things. One is the technology is amazing, and it's moving so fast, but it's allowed us to really delve down into individual patients, so that if you take a patient and put them on a trial, you can first check to see, do they have immune cells in their tumor? And then you can see, do those immune cells get developed, and then what's holding them back? And we're using the technology now to see what's holding them back. And we can find that there's new braking drug or new mechanisms that we know can put the brakes on the immune system and not let it kill the cancer. So now we're trying to figure out how to design new trials that will add these things together. So that's what's up next? That's what's up next. I think for us it's somebody who doesn't have their immune system turned on, what are you going to do? So we've, here in Portland, we've developed a treatment, a vaccine, which actually can educate the immune system to recognize the cancer. And so what's good about this is a very broad-based strategy that actually turns on the immune system to fight not just one cancer type, but breast cancer, lung cancer, prostate cancer. These are things that are shared among all these different cancer types. So we think that we've got something that will turn on the immune system. Now we can give the patients these drugs that take the brakes off the immune system, and we'll have a much higher response rate. So that's part of what's up next. The other part is that there's these things that maybe dark genome, dark matter that we can talk about, but these are things that we didn't know about in cancer. Nobody knew about them until about 3 years ago.
Wow.
And so now we know that they're the things that are at least in some cancers, these elements of our genetic information are responsible for the rapid proliferation of cancer in some cases, and for their ability to go to other parts of your body to metastasize. So now we know there are new things that we can target.
Right.
And so now we're working on developing strategies that will target those to hopefully make the immune system get really turned on and activated so that it will cause the immune system to destroy more and more of the cancer.
You are fascinating. We have to have you back on the show.
Yeah.
Thank you for all you do. I can see why you're being honored. We want to tell everyone, if you'd like to find out more about immunotherapy or all the work that's going on at the Providence Cancer Institute, give them a call. The number is on your screen. We'll also put it on our website at KATU.com/Family Matters. Doctor, thank you so much.
Thank you, Helen. Very